Secretary of State for Health, Wes Streeting.
Thank you, Madam Deputy Speaker. With permission, I'd like to make a statement on the future of NHS England. Since coming into office, this government has made big strides in fixing our broken NHS. Under the Conservatives, the NHS suffered years of industrial action, costing taxpayers billions and costing patients more than 1 million cancelled operations and appointments. We negotiated an end to the resident doctor strike within 3 weeks. We have delivered the 2 million extra appointments we promised in our first year, and we did it 7 months early. And after 14 years of rising waiting lists under the Conservatives, we are finally turning the tide. Cutting waiting lists for 5 months in a row, cutting waiting lists through the winter pressures, cutting waiting lists by 193,000 so far and counting. We have agreed the GP contract with GPs for the first time since the pandemic, our first step to bringing back the family doctor. And we have delivered the biggest uplift in hospice funding for a generation. But there should be no doubt about the scale of the challenge ahead. We inherited an NHS going through the worst crisis in its history, so there is no time to waste. We inherited public finances with a £22 billion black hole, so there is no money to waste. The urgency of the crisis means we have to go further and faster to deliver better value for taxpayers and better services for patients, something the party opposite can't even begin to speak to a record on. Lord Darcy's independent investigation into the National Health Service traced the current crisis back to the 2012 top-down reorganisation of the NHS by the Right Honourable Lord Lansley. The Darcy investigation said the reorganisation was, and I quote, disastrous, a calamity without international precedent. It scorched the earth for health reform, the effects of which are still felt to this day. The Health and Social Care Act established more than 300 new NHS organisations, created a complex and fragmented web of bureaucracy, and, to quote the Darcy investigation, imprisoned more than 1 million NHS staff in a broken system. Well, today, Madam Deputy Speaker, we are putting the final nail in the coffin of the Conservatives' disastrous top-down reorganisation of the NHS. There are more than twice as many staff working in NHS England and the Department of Health and Social Care today than there were in 2010. Twice as many staff as when the NHS delivered the shortest waiting times and the highest patient satisfaction in history. Today, the NHS delivers worse care for patients, but is more expensive than ever before. The budget for NHS England staff and admin alone has soared to £2 billion. Taxpayers are paying more, but getting less. We have been left with 2 large organisations doing the same roles with an enormous amount of duplication. It is especially in times like these, when money is tight, that such bloated and inefficient bureaucracy cannot be justified. But even if the Conservatives hadn't left a £22 billion black hole in the public finances, the Prime Minister would still be announcing the changes he is today. Because every pound that is wasted on inefficient bureaucracy, in good times or bad, is a pound that can't be spent on treating patients faster, nor can it be spent on fixing our crumbling schools, lifting children out of poverty, or putting money back into people's pockets. There is always a duty on ministers to get as much value for taxpayers' money as is possible, and I cannot honestly say that it is achievable with the way that my department and NHS England are set up today. Nor can I say that the current setup is getting the best out of our NHS. I'm sure members will have heard their local NHS leaders complain about the top-down way in which the NHS is run. It is something I have heard for years. And now I find myself at the peak of this enormous mountain of accountability, I don't just recognise the complaint, I agree with it. Frontline NHS staff are drowning in the micromanagement they are subjected to by the various and vast layers of bureaucracy. In the Hewitt Review, the former Health Secretary, my right honourable friend Dame Patricia Hewitt, reported that one local service was required to send 250 reports and forms to NHS England and the Department of Health and Social Care in a single month. That is time and energy that is not being spent delivering care for patients. The Hewitt Review also concluded that having two organisations doing the same jobs has led to, and I quote, tensions, wasted time and needless frictional costs. Since coming into office, I have sought to correct that by building a one-team approach between my department and NHS England, working towards our shared mission of building an NHS fit for the future. Today, the Prime Minister is announcing that we are turning one team into one organisation. I want to acknowledge that there are talented, committed public servants working at every level of the NHS and my department, including at NHS England, who I've had the privilege of working with over the past 8 months. The reforms we are announcing today are not a reflection on them. They have been set up to fail by a fragmented system that holds them back. The actions we are taking today will change that. Work has already begun to strip out the duplication between the two organisations and bring many of NHS England's functions into the department. NHS England will have a much clearer focus over this transformation period. It will be in charge of holding local providers to account for the outcomes that really matter, cutting waiting times and managing their finances responsibly. And it is tasked with realising the untapped potential of our National Health Service as a single-payer public service, getting a better deal for taxpayers through central procurement, being a better customer to medical technology innovators to get the latest cutting-edge tech into the hands of staff and patients much faster, and being a better partner to the life sciences sector to develop the medicines of the future. Over the next 2 years, NHS England will be brought into the department entirely. These reforms will deliver a much leaner top of the NHS, making significant savings of hundreds of millions of pounds a year. That money will flow down to the front line to cut waiting times faster and deliver our plan for change. By slashing through the layers of red tape and ending the infantilisation of frontline NHS leaders, we will set local NHS providers free to innovate, develop new productive ways of working and focus on what matters most, delivering better care for patients. Madam Deputy Speaker, I cannot count the number of Conservatives who have told me in private that they regret the 2012 reorganisation and wish they had reversed it when in office. But none of them acted. They put it in the too difficult box while patients and taxpayers paid the price, because only Labour can reform the NHS. And, Madam Deputy Speaker, the government is proving that only Labour can be trusted to reform the state. The Prime Minister has committed to cutting the number of quangos. Today, we are abolishing the biggest quango in the world. I'm delighted that Sir James Mackey will be leading the transformation team as the Chief Executive of NHS England. Jim has an outstanding track record of turning around organisations, balancing the books, driving up productivity and driving down waiting times. He is putting in place a new transformation team to drive change. And alongside Dr. Penny Dash as the incoming chair, I'm delighted to have such a capable leadership team of radical reformers to lead NHS England with me through this transformation. I would also like to take this opportunity to place on record my heartfelt thanks to Amanda Pritchard, who has shown an outstanding commitment to our National Health Service over her decades of service, which I know remains undiminished. She has also been a rock of enormous support not only in the past 8 months, but also in the past few weeks as we have worked together with Jim preparing for this change. I'd also like to place on record my thanks to her deputy, Julian Kelly, who is one of the most outstanding public servants of his generation, and I'd like to thank the rest of the leadership team departing at the end of this month. They deserve our thanks and best wishes for the future. Madam Deputy Speaker, change is hard. There will always be cautious voices warning you to slow down. However broken the status quo is, there will be those who resist any change away from it. But we should be in no doubt. We inherited a National Health Service going through the worst crisis in its history. Patients are waiting unacceptable lengths of time for an operation, a GP appointment, or an ambulance. This Labour government will never duck the hard yards of reform. We will take on vested interests and change the status quo so the NHS can once again be there for us when we need it. The Prime Minister has set an enormously ambitious target for the NHS to cut waiting times for operations from up to 18 months to a maximum of 18 weeks by the end of this Parliament. It will require us to go further and faster than even the last Labour government achieved. But patients in our country deserve nothing less. The reform the Prime Minister is setting out today will mean fewer checkers and more doers. It will cut through the complex web of bureaucracy and devolve more resources and responsibility to the front line to deliver better value for taxpayers' money and a better service for patients. And it will set the NHS up to deliver on the 3 big shifts needed to make the service fit for the future, from hospital to community, analogue to digital, and sickness to prevention. Madam Deputy Speaker, the NHS is broken, but it is not beaten. Together we will turn it around, and I commend this statement to the House.
Shadow Minister Dr Caroline Johnson.
Thank you, Madam Deputy Speaker, and thank you to the Secretary of State for advance sight of his statement. It is disappointing that once again this was not made to the House first, and in recent days there have been numerous media briefings about the potential for this restructure. Madam Deputy Speaker, under new leadership on this side of the House, we believe in a leaner and more efficient state. That means using resources effectively, reducing waste and preventing duplication, spending money where it is most beneficial. After all, the public understandably want to see the focus on patient care and not on backroom managers. Therefore, we are supportive of measures to streamline the management, and we do not oppose the principles of taking direct control. But we need to know what steps will be taken to meet targets while all this upheaval happens. We need to know some specifics on what is being planned. What are the timeframes for abolition of NHSE? What date will it be completed by? How many people will be moved into different roles? How many people will lose their jobs altogether? How much money is this expected to save? Labour run the NHS in Wales, where they have the highest waiting lists and the longest waiting times in GB. So what lessons have Labour learnt from their failure in Wales? NHS England has, as the Secretary of State said, just lost much of its leadership. Is that because they had no longer got confidence in the Secretary of State, or because he did not have confidence in them? Perhaps he can tell the House whether Alan Milburn in particular will be someone who does keep his job in this upheaval. We also need to be clear that moving people into different roles will not fix the challenges that face the NHS. The Secretary of State has spoken about taking direct control. This may help him ensure that the NHS stop wasting money on expensive DEI staff and ensure that they do provide dignity and privacy for female staff and patients. But what does it mean for clinical prioritisation? Will conditions that are less common and have less glitzy campaigns, less celebrity backers, suffer because the Secretary of State has now got political considerations? Does the Secretary of State have the bandwidth for this, given he has such a busy role already? And how does the centralisation of power measure up with commitment to give more powers to regional bodies and local integrated care boards? In the first 6 months after entering office, the government has announced 14 reviews, consultations and call for evidence. These all require more staff. Are these jobs at risk, or is it other pre-existing roles which are set to be cut? This announcement comes the same week as the Labour's Employment Rights Bill passes through the Commons. Is the Secretary of State getting a move on because he knows that red tape and bureaucracy will dramatically increase afterwards and make the necessary decisions he has to take more difficult to deliver? While drives to improve efficiency within the civil service and management of the health service is welcome, what about the NHS itself? The government slimmed down our productivity plan and delivered a 22% pay rise in return for no modernisation or reform. How will these decisions improve efficiency? I asked the department what proportion of people with a nursing qualification working in the NHS are in patient-facing roles, but the Minister said they did not know. How can he use the skills and resources effectively if he does not know where those skills and resources are? And while the Prime Minister is making a lot of noise about productivity and cutting waste, he still refuses to set a target for cutting the civil service headcount. And thanks to the decisions he and the Chancellor took at the budget, the size of the state is growing rapidly, not shrinking. Changes to national insurance contributions have diverted funding away from the front line and to compensating the Treasury. And ultimately, any restructure will be challenged by the government's continued failure to tackle immigration. So while steps to improve efficiency in the healthcare service are welcome, these words ring hollow across government.
Madam Deputy Speaker, taking the more serious questions the Shadow Minister raises first. In terms of timeframes, we'll be working immediately to start bringing teams together, as we have been with the one-team culture we've been building for the last 8 months. But I want the integration of NHS England into the department to be complete in 2 years. She asked about the reduction of officials. The size of NHS England, there are 15,300 staff. In the Department of Health and Social Care, 3,300. And across both, we're looking to reduce the overall headcount by 50%. That will deliver hundreds of millions of pounds worth of savings. The exact figures will be determined by the precise configuration of staff, and obviously we'll keep the House updated on that. She asked about clinical leadership. One of the changes that we'll be making in terms of the transformation team is to ensure that succeeding Professor Sir Steve Powis, whose departure from NHS England was planned long before these changes, there will be 2 national medical directors, one for primary care, one for secondary care, underpinning our commitment to the shifts that we've described. I must say, on clinical leadership, there are enormous improvements to be made in terms of patient outcomes, patient safety and productivity. And I'm demanding stronger clinical leadership to drive those improvements to productivity. Frankly, many consultants and clinical teams on the front line will welcome that liberation. They are hungry for change. She asked about the data for the workforce and complains we've not been able to give her the precise answers. I agree, it is frustrating not having that precise information at my fingertips. I just gently remind her on this, as with so many things, her party was in power for 14 years. She can't very well complain 8 months in that they left a data architecture and infrastructure, which is woeful and embarrassing. She asked about efficiency, and once again she refers to the resident doctors deal as if this was a failure. The actual failure was leaving doctors on the picket line, not on the front line. The failure was wasting huge amounts of taxpayers' money, and the cancellation delay to patient appointments, operations and procedures. We got rid of that within weeks of coming into office. The deal does include reforms that will improve productivity, and if she's in any doubt about the results, she should look at the fact that despite winter pressures, NHS waiting lists have fallen 5 months in a row. Once again, we get the facile points about my right honourable friend Alan Milburn, who is the lead non-executive board member for my department. I honestly don't know why he bothers to pay for a mortgage. He lives rent-free in their heads. They need to move on. And by the way, just for the record, Alan Milburn has a record on the NHS that the party opposite can't even begin to touch. She asks about confidence. I am, as I say, delighted to be introducing a new transformation team. Different challenges, different leadership challenges require different leadership skills. And as I say, I have been really pleased to work with Amanda Pritchard for the last 8 months and delighted to work with her on this transition. So people should have no doubt in the confidence I have in her skills, talents and abilities, and I think she has a lot still to contribute to our NHS. On the issue of confidence, we don't need to ask about confidence in the Conservative Party. It's reflected by the scarce numbers opposite. And on Wales, well, what's the lesson there? The lesson is that when you have a Conservative government in Westminster, in England, Wales, Scotland and Northern Ireland, the National Health Service suffers. That is why we are creating a rising tide to lift all ships, and I'm sure we will see improvements across the United Kingdom. The SNP, not in their place, don't have any excuses now because, as I said before the election, all roads lead to Westminster, and down that road to Holyrood it is going the biggest funding settlement since devolution began. So no hiding places there for the SNP, but if people want real reform of the NHS in Scotland, they should vote for Scottish Labour and Anas Sarwar and Jackie Bailey. And look, people can see here in Westminster the difference that new leadership provides. The Shadow Minister opposite laughably referred to new leadership in the Conservative Party. Well, it's certainly leaner, it's certainly meaner, but it is the same old Conservative Party. The only thing they've shrunk is their own party. The only jobs they have laid off are their poor party staff. And the only thing they're capable of changing well, in fact, I don't think there is anything they're capable of changing, come to think of it. Instead, what they do is look over their shoulder at one man leading a party where he can't even manage a five-a-side team, let alone a country. So diminished are they. I appreciate it must be so painful for the Conservative Party. It must be so painful watching a Labour government doing the things that they only ever talked about, reducing the size of bloated state bureaucracy, investing in defence, reforming our public services, bringing down the welfare bill. The public are asking, what is the point of the Conservative Party? I bet they're glad they chose change with Labour.
Dame Meg Hillier.
Thank you, Madam Deputy Speaker, and I applaud my right honourable friend for his leadership and the reduction in waiting lists, which we so desperately need. We all know that there's still a struggle in the health service with budgets. My excellently run Homerton Hospital is facing a deficit for the first time in its history. So could he give more detail about NHS procurement and how he's going to reform that so we can use the purchasing power of the NHS to get more bang for our buck?
Secretary of State.
I'm grateful to my right honourable friend for her question. She's absolutely right about the need to improve procurement. And look, I think one of the things that Attlee and Bevan couldn't have predicted in 1948 is that the single-payer model of a national health service makes it ideally placed for this world of artificial intelligence, genomics, machine learning, big data, and we've got to unlock that potential so that we can make sure we've got new treatments, new technology, productivity gains and efficiencies, but we've also got to get the basics right on procurement. And we've got to change the culture of profligacy, routine deficits and routine overspending. That is why today the leadership of NHS England have summoned to London chairs and chief executives from across the country to get an immediate grip on the £5 to £6 billion deficit that was already being baked in for the 25-26 financial year, because they have become so accustomed to the idea that governments will just come in and bail them out. I said before the election that there would be no release of money in winter because winter is predictable, they were given additional resources and the NHS has to learn to live within its means. And despite howls of outrage before and since the election, I've kept to my word. I said that there would be accountability for people who think that government comes along to bail people out. Having come from a local government where that culture would never be tolerated, we are bringing that same financial discipline to the NHS. We will not tolerate deficits. It is important we get better value for money, and making sure that nationally we're providing that support in terms of the procurement platform. That is how we will help the system to deliver better value, and we will liberate frontline leaders to focus on the things that really matter, which is services for patients.
Liberal Democrat spokesperson Alison Bennett.
Thank you, Madam Deputy Speaker. The Secretary of State's NHS shake-up is well underway, and I think many members in this place would agree that the NHS used to be the envy of the world, but years of Conservative failure have left patients suffering and unable to get the care they desperately need. I and my Liberal Democrat colleagues therefore welcome steps to reform the NHS. The new leadership of the NHS has much to do. But could the Secretary of State advise whether new legislation will be needed to scrap NHS England, given his answer to the member across the way, that it's going to take 2 years for this merger to complete? So when will this new legislation, if it's required, be brought forward? But Any attempt to fix the NHS will ultimately fail if we also don't address the crisis in social care. The Secretary of State must show the same urgency in reforming social care as being shown to the NHS. Where is the urgency? Long-promised cross-party talks have now been postponed indefinitely with no new date in sight, and care providers are hanging by a thread due to the rising cost of national insurance contributions. Does the Secretary of State agree with me that any attempt to fix the NHS will prove futile if we ignore the elephant in the NHS waiting room that is the crisis in social care? We will clear our diaries for cross-party talks. So, will the Secretary of State give us a date today?
Secretary of State.
I'm grateful to the Liberal Democrats for those questions. In terms of the change that's needed, much of the change can be delivered without the need for primary legislation, which is a relief because, as honourable and right honourable members will have noticed, this government has come into office with the most ambitious legislative programme of any incoming government. So time is of a premium in terms of the business of this House and the other place. So we will work immediately to move forward without changes to primary legislation, but of course we will need to make primary legislative changes, and I'm working with the Leader of the House and business managers to make sure we've got an appropriate timetable that enables us to do the things that we need to do in a timely way, but also safeguards the ambitious legislative programme that has already been set out. She is right to talk about the importance of social care. She says, where is the urgency? The urgency was to be found with the immediate steps the Chancellor took on coming into office to stabilise the finances of my department with an immediate release of funding. It came with the budget that delivered £26 billion extra for the Department for Health and Social Care, and the protected funding specifically for social care, and the boost in spending power for local authorities. The urgency came with the biggest expansion of carers allowance since the 1970s. The urgency came with £86 million increase in the disabled facilities grant, not just for the next year, but released in January for the remainder of this financial year. And the urgency is reflected in the Employment Rights Bill, which makes provision for fair pay agreements to deal with the workforce crisis, and where work with employers and trade unions to prepare for that legislation, and the introduction of fair pay agreements is already underway. I do regret that we've not convened cross-party talks. That's genuinely due to practicalities on the part of a number of parties involved. We will be in touch over the next week to make arrangements for Baroness Casey to engage with parties across the House.
Dr Simon Offer.
Thank you, Madam Deputy Speaker, and can I thank my right honourable friend for his excellent statement. As he knows, I am a working GP in Stroud. We clinicians are simply fed up with the micromanagement of our caring clinical role, as I know that many hospital colleagues feel the same. We want to be free to deliver excellent clinical care. So does he think that the abolition of the NHSE will reduce the admin tasks for doctors?
Secretary of State.
I'm grateful to my honourable friend for that question. I do think that's the case. I also think that this is not just about form and function, it's also about the opportunities for productivity gains through modern technology and practices. And one of the frustrations I have is that whenever we talk about the exciting frontiers of life sciences and medical technology, this country's competitive advantage and how we need to build on that position, I'm greeted with a weary sigh from poor frontline NHS staff and managers for that matter, who say that's lovely and we agree with you, but we'd just like a machine that turns on reliably. And it'd be nice to use systems that don't require 7 passwords to log in to deal with a single patient. So I feel their pain, and we will prioritise that investment in technology. I think the final thing I just want to say, we do want to liberate the front line, and I'm really grateful to the leadership that GPs have shown in agreeing a contract with government for the first time since the pandemic, which contains substantial reform elements to benefit them and, crucially, and even more importantly, their patients. We've also got to liberate management in the NHS as well. As Lord Darcy said, it's not the case that there are too many managers as such as layers and layers and layers of bureaucracy between me as the Secretary of State and frontline staff. We've got to liberate frontline staff and managers to help them be more effective, to manage resources more efficiently, and most important, to deliver better and safer care.
Chair of the Select Committee, Leila Moran.
Thank you, Madam Deputy Speaker. Well, this is a bold change indeed, and the job of my committee is to help him do it. So may I start by asking him to commit to come in front of the committee as quickly as possible, certainly before Easter, because there's a lot of detail in here that we need to drill down into. My more substantive point I want to ask, he mentioned the financial reset, I think it's been called, that Sir Jim Mackey set to ICBs just yesterday. That means that they need to cut their running costs by 50%. My concern, and we've seen this in Bob, the Berkshire, Oxfordshire and Buckinghamshire ICB that is my ICB, when they struggled with money, the first thing they cut were the place-based teams. Now, if we are to deliver the neighbourhood NHS that he and I both want, those are not the teams that need to be cut. Will he send a signal to ICBs that as they find cost savings, it should not be at the expense of the broader shifts in the 10-year plan?
Yes. Secretary of State.
Can I firstly give the Chair of the Select Committee my assurance that I'd be delighted to appear in front of her committee at the earliest opportunity, and that means soon, because I appreciate her committee will want to scrutinise in more detail, and I would welcome that constructive challenge that her committee offers. I also want to reassure her that the direction we are giving to frontline leaders is to deliver the 3 big shifts in our 10-year plan, and to make sure that as we take immediate steps to bring the finances under control, that we are doing so in a way that lays the firm foundations for the future of the NHS that we need to build. I guess the cautionary note I would make to members right across the House is that when we ask frontline leaders to reform and to change ways of working, sometimes that does mean not just changes to the bureaucracy, as it were, which is the kind of easier and lower hanging fruit. Sometimes it does require service reconfiguration in the interests of patient outcomes and better use of taxpayers' money. Sometimes they get those changes wrong, and I've successfully campaigned against closures of services like King George Accident and Emergency Department, which shouldn't have been closed, and where we won the case on clinical grounds. But sometimes, and let's be honest, the public can get anxious, and members of Parliament feel duty-bound to act as megaphones and amplifiers for public concerns. I think it's really important that we support and engage with local NHS leaders. By all means, scrutinise, challenge, ask questions, but we've got to give local leaders the support to do the task that we are asking them to do on behalf of patients and taxpayers. And that is why the powers that I have to intervene in those frontline service reconfigurations are those that I will use in only the most exceptional and necessary cases, and why I have not used them once in the last 8 months.
Jen Croft.
Thank you very much, Madam Deputy Speaker. The crisis in our NHS goes deep, and I assure the Secretary of State will agree with me that the nature of it is existential and poses a real threat to the future of the NHS if fundamental change does not happen. So I strongly welcome the statement today. However, I would like to ask the Secretary of State what assurances he can give myself and the House that the right people will be in the right place in leadership positions to drive this fundamental change that is necessary.
State.
That is an excellent question from my honourable friend. Look, we are building with Sir Jim Mackey an outstanding transformational team which will be announced very shortly, and which brings together some of the best leaders across the country and expertise from outside the NHS to drive the scale and pace of transformation that is necessary. She is right to say that it is existential. It is existential because we cannot allow the curve of cost and demand to continue to rise to the extent that it is. The NHS's long-term workforce plan, for example, has 1 in 9 people in our country working for the NHS, and on current trajectory, in 50 years' time, 100% of the public will be working for the NHS. That is clearly not a sustainable position, and I tell people now who resist this reform out of love for the NHS, do not kill it with kindness. We have got to bend the curve of cost and demand to make sure that our health services are sustainable for the long term on the equitable foundations of a public service free at the point of use that we will always defend. And I also say to my honourable friends behind me, if we don't get this right, goodness knows what will come next. The Leader of the Opposition says she wants a debate on the funding model for the NHS. The Leader of the Reform Party, I'm not sure who is the Leader of the Opposition yet, the Leader of the Reform Party says that he's up for anything. I'm sure he is, and that should worry us. But let me just say, to those who say we want to debate the funding model of our NHS and the equitable principle as a public service free at the point of use, we're happy to have that debate, but on this side of the House, we're unequivocal. With the Labour, the NHS is not for sale, and it will always be a public service free at the point of use, so that when you fall ill, you never have to worry about the bill.
Jeremy Hunt.
Thank you, Speaker. Can I commend the boldness of today's announcement? If the NHS is going to be turned around, it's going to need radical reforms. If the result of today is to replace bureaucratic over-centralisation with political over-centralisation, it will fail. But if what happens today is that we move to the decentralised model that we have for the police and for schools, it could be the start of a real transformation. So will the Secretary of State tell the House more detail about the changes he has in mind? Are we actually going to get rid of these central targets that make the NHS the most micromanaged system in the world, make it impossible for managers to deliver real change on the ground because they're working to about 100 operational targets? And if that is the case, and we are going to decentralise the NHS, does he agree there remains a vital role for a reformed CQC to call out poor care whenever it finds it?
Secretary of State.
I'm grateful to the right honourable gentleman for that thoughtful question. And let me say to him two things. Firstly, democratic accountability matters, both in terms of patient outcomes and value for taxpayers' money. And one of the things that I think I and my Labour and many of my Conservative predecessors have reflected on a lot over many years is what the role of the Secretary of State and Government is in a national health service where clinical decisions should always be clinically led. And I think it's the responsibility of the Secretary of State to be the champion for patients and the champion for taxpayers, and to make sure that the system as a whole delivers better outcomes for patients and better value for taxpayers. But the argument I have started, and it has ruffled some feathers within the NHS, but even more so with some of our country's most loved charities in recent months, is this fallacy that the Secretary of State can or should just fire endless instructions into the system as if a Secretary of State, or for that matter, an NHS England, could just pull some big levers and drive change in such a vast and complex system. This is a falsehood. Of course, we should set national strategic priorities on behalf of the public. We should make sure there is more transparency and information so that patients and communities and staff can hold the system and themselves to account to improve performance. But this over-centralisation has got to stop. And so for the future, it will be for the department and the NHS nationally to do those things that only the National Health Service can do, providing the enablers for the system as a whole. But what we are presiding over and embarking on is the biggest decentralisation of power in the history of our National Health Service, putting more power into the hands of frontline leaders and clinicians, but even more fundamentally and transformationally, more power into the hands of patients. If we get this right, we will have an NHS that can be truly the envy of the world. But if people continue to indulge in the fallacy that just more targets from the centre or more political control, or indeed less political control, is the answer, then we will fail. He also mentions the CQC. It's got itself into a terrible mess, and I know that's not what he intended when I think he rightly made the decision to create the Care Quality Commission. That's why Sir Julian Hartley knows that he has our full support, not just in turning around the CQC as it is, but reforming the CQC so that it can be the best guarantee and safeguard of quality that patients and the public deserve. And Dr. Penny Dash's forthcoming review findings, I think, will help to drive that reform agenda and at pace.
Josh Fenton-Glynn.
Thank you, Madam Deputy Speaker. I thank the Secretary of State for making this statement today, and I'd like to echo the thoughts of the member for Oxford West and Abingdon, that it would be very helpful to see him in front of the Select Committee to outline his vision for NHS England. Perhaps today he can tell us how the new structure of the NHS will help us deliver truly excellent social care and also primary care, and what drivers he can use to make that happen.
Secretary of State.
Yes, I'm grateful to my honourable friend. It always worries me when he says he wants to see me in front of the Select Committee because he doesn't pull his punches despite being on this side of the House. Let me just say to him and reassure him actually that firstly on primary care, I hope we are beginning to turn what has been, I think, a deep anger and frustration and anxiety among primary care leaders about the state of the system as it is and the pessimism about its future into increasing amounts of quiet optimism and hope. I think GPs can see we are walking the talk with the biggest funding uplift in a generation. The fact we work constructively with GP leaders to reform the contract and agree that further more radical reform is needed together, and we'll be embarking on that under the auspices of the 10-year plan. We are, my honourable friend, the Minister for Care, as well as delivering that significant achievement with GPs, is also in the very final stages of work with pharmacists to stabilise the community pharmacy sector, which is vital for the NHS's future as a neighbourhood service. But can I also reassure my honourable friend that under the auspices of the 10-year plan for health, notwithstanding Baroness Case's work on the long-term future of social care, we do have an eye on social care and the relationship between health and social care. And so people won't be waiting until next year for the first Casey report, or indeed later for the final Casey report on the longer term, to see action from this government on social care, particularly as it relates to the NHS.
John Glenn.
Thank you, Madam Deputy Speaker. I welcome the ambition of the Secretary of State today. One area that I would ask him to focus on is the future of the UK Health Security Agency. Over the last 15 years, it has evolved from the Health Protection Agency to Public Health England and now to the UK HSA. And I found it impossible, both as a Treasury Minister and as a constituency MP, to penetrate the decision-making process around resource allocation, which I now believe is duplicative as they contemplate a move to a new site in Essex. So this is an area where the Secretary of State will be able to demonstrate to my constituents in Salisbury and at Porton Down that he means business and once and for all can resolve the future of UK HSA.
Secretary of State.
I'm grateful to the right honourable gentleman for his question. And I'd be delighted to speak with him further, drawing on that experience, I think valuable experience, both as a constituency MP and as a Treasury Minister, who are always, for the record, my favourite people to work with, and my friends at DCMS with their considerable spending power. No, I'll stick with the Treasury, thank you very much, in my order of favourites. I know where my bread's buttered. But seriously, back to the honourable gentleman's point, I want to thank Dame Jenny Harris for her leadership of UK HSA. We obviously are now recruiting for an outstanding replacement and successor, and I think that's an opportunity to look in the wider context at some of the first principles. And he mentioned the specific decision, which has been running around the system so long, that is now used in a case study for senior civil servant recruitment about the traditional Porton Down versus Harlow decision. The worst decision is indecision. It has plagued us too long, and I hope we'll be able to report back to the House with a decision on that for everyone's benefit soon.
Danny Beales.
Deputy Speaker, and I welcome the statement today from the Secretary of State to the House. Clearly there is massive duplication of functions across the many regulatory, national, local and regional NHS bodies, and huge room for efficiency, so I welcome the statement. I just want to press the Secretary of State on 2 points. One is that the bonfire of bureaucracy will not stop effective local management of NHS trusts and community settings. The IPPR found that locally the NHS is poorly and undermanaged, and clinical staff are backfilling admin and management roles. So that this won't stop the addressing of that. And secondly, as he mentioned today, the rollout of digital technology has been far too slow, with NHS Digital moving into NHS England, not directing change fast enough. So how will this change ensure that Department for Health grips the digital rollout, accelerates it and ensures the properly integration of NHS digital functions?
Secretary of State.
Great question from honourable friend. We've got to give people the tools to do the job. The Prime Minister set me and my honourable friends in the department an enormous challenge on behalf of the public And in turn, I'm setting an enormous challenge for NHS leaders at every level, but particularly frontline NHS leaders. We've got to give them the tools to do the job in terms of data platforms and the technology that they are given to work with, making sure they've got access not just to cutting-edge treatments and medical technology, but also to the back office productivity support that can drive efficiency and improvement and, frankly, liberate managers and liberate frontline staff from the arcane systems they are working with. I think the final thing I would say is some of the very best people I have met in the last few years shadowing this portfolio and now holding it in government are NHS leaders, especially on the front line. And it is my responsibility to give them the tools to do the job. And that's not just about financial resources. It also means bulldozing through some of the regulatory barriers and over-centralised instructions that stop them making decisions in the best interests of patients in terms of clinical pathways and value for taxpayers. And I have given them an undertaking that I will have their backs, both in terms of the decisions that they will have to take on the front line, but also bulldozing through the national bureaucracy that's tying them up in knots when we need to set them free.
Richard Tice.
Thank you, Madam Deputy Speaker, and I congratulate the Secretary of State on these changes announced today, cutting unnecessary waste and bureaucracy, because we all know that whilst healthcare, and we all agree healthcare should remain free at the point of delivery, and of course that the NHS needs reform. But just last Saturday, Secretary of State and Madam Deputy Speaker, last Saturday I was in a care home in Boston with a lady, an expert who the Secretary of State knows, Melanie Weatherly, and she was telling me about the unnecessary processes within NHS England on the front line that was constraining good care in care homes, which was imposing unnecessary constraints on ambulances and blocking A&E wards. So will the Secretary of State confirm that these changes and reforms will include unnecessary processes on the front line in care homes?
I can certainly give the honourable gentleman that assurance. We've got to cut through the unnecessary red tape that ties up leaders and frontline staff in knots, and we are absolutely determined to do that, and regulatory reform will form a big part of this department's agenda, as it is the wider government's agenda. As to an NHS free at the point of use, he almost said it with a straight face. Yeah. And I'm sure that he meant every word he said. I think he might want to have a word with his party leader, indeed his successor, and maybe, who knows, his predecessor.
Rachel Maskell.
Thank you, Madam Deputy Speaker. We must remember that NHS England came out of the reforms from the Tory government, which were intended to privatise the NHS. But I do want to thank the staff at NHS England for the work they've done. But I am sorry in the way that they've heard of this announcement, because I know it's their jobs which are being put at risk today. We have got to ensure, however, we're not replicating NHS England across the ICBs of our country, and that ICBs also are reformed to transform the NHS with the 3 shifts which will be placed on them with the publication of the 10-year plan. How will my right honourable friend ensure that we have the machinery to hold the system to account, but also bring those reforms in place?
Secretary of State.
I'm grateful to my honourable friend for her question. Firstly, she is absolutely right. If we are just replicating NHS England as it is, with all of the challenges that it has in its setup, in ICBs across the land, we will have failed. Frankly, if we replicate NHS England and the department as they are today, just in one organisation, then we will have failed to meet the challenge of change. It needs to feel like and act like a completely new organisation, culture, way of working to modernise the state, so that if Disraeli or Gladstone or Churchill or Attlee walked into Whitehall at the end of this government, it wouldn't look so much like the government they worked in the 19th and 20th centuries. That's the reality of Whitehall today. It's not a reflection on the people who work in it, but it shows why it needs to change, and that is also true of the NHS. And I'm looking forward to working with ICB leaders to reform their ways of working, to clarify their priorities, give them clearer marching orders, and make sure that they are able to deliver. Finally, she mentions the staff of NHS England, indeed staff in my department too, and I thank her for the care that she has shown. Change is always disruptive and can be scary. And of course, when job losses are involved, I know that is particularly the case. And I want to acknowledge that on the floor of this House, as I have both to staff across both organisations this morning, and I know the Permanent Secretary and the Chief Executive of NHS England has done in recent days, and I'll be holding a town hall with staff next week. This really isn't a reflection on them. In fact, I think they will recognise in my description of our ways of working the many things that frustrate them. Nonetheless, they are dedicated, talented people, some of the best people I have ever worked with in any walk of life or any career I've worked in, work in this system, and I'm looking forward to working with them with the same dedication and professionalism they have always shown in the coming weeks and months, so that we will all be able to look back on this time and with pride at having taken the NHS from the worst crisis in its history and been part of the team that got it back on its feet and made it fit for the future.
Julian Lewis.
Does the Secretary of State agree that one of the worst and most intractable problems that the founders of the NHS had to deal with was the involvement of medical practitioners and consultants who were used to receiving a private income in a national service where they would not receive anything like the same remuneration? If he does agree with that, would he accept that there's a similar situation with NHS dentistry today, where the Darcy report actually said that, and I quote, "There are enough dentists in England, just not enough dentists willing to do enough NHS work, which impacts on provision for the poorest in society." How does he think his reforms will help address that particular crisis on which honourable members like myself and my honourable friend from New Forest West are being consistently and rightly lobbied by such formidable organisations as the New Forest branch of the Women's Institute, for example?
Secretary of State.
I'm grateful to the honourable gentleman for his question. The NHS dentistry is in a terrible state, and in fact in lots of parts of the country it barely exists. There are lots of reasons for that, and it's a source of constant astonishment to me that the dentistry budget was underspent year after year after year despite that situation. My honourable friend, the Minister for Care, is working with the British Dental Association to reform the contract. I know they are frustrated at the pace, so am I. We're trying to clear through an enormous challenge. It is not going to be easy, but we are committed to working with them. We are rolling out the 700,000 urgent dentist appointments and supervised toothbrushing as we promised, and the BDA is welcomed, but we've got a lot more to do, and I think that requires working with the profession, not simply tinkering with the system as it is, but fundamentally rethinking it and how we rebuild it to an NHS dentistry service we can be proud of.
Jim Dixon.
Thank you very much, Madam Deputy Speaker, and can I welcome the statement today, particularly its commitment to ensure that as much money in the NHS is spent at the front line where it can really affect patient outcomes, and nowhere is this more needed than in my constituency of Dartford, the fastest growing town in the UK, with that extra population imposing a huge strain on our local District General Hospital at Darrant Valley, despite the excellent efforts of the staff there. So could the Secretary of State outline how this change is going to support the shift that we need to see from services in hospital into the community and thereby relieve the strain on hospitals like Darrant Valley?
Secretary of State.
I'm grateful to my honourable friend for his question. I think the frustrating thing for me is that we're delivering the wrong care in the wrong place at the wrong time, which is delivering poorer outcomes for patients and poorer value for taxpayers. People can't get a GP appointment, for example, which might cost the NHS £40. They end up in accident and emergency, which could cost £400. If people can't find a bed for a delayed discharge and rehabilitation, outside of hospital, they end up stuck in a hospital bed, wasting away at greater cost. In fact, when I was up in Carlisle earlier this year, such intermediate care was being offered by a local social care provider commissioned by the NHS at half the cost and much better quality than the hospital bed that patients had been discharged from. So that shift to community from hospital is about delivering better outcomes for patients, better value for taxpayers, and that will be reflected in our 10-year plan.
Vera Hobhouse.
Thank you, Madam Deputy Speaker. I declare an interest as the Vice Chair of the newly formed Emergency Care APPG. A&E staffing across the country is dangerously low, especially at night, putting unacceptable pressure on staff who warn persistently about the risks to patient safety. Hundreds of keen applicants are turned away from emergency medicine training. Last year, there were 359 places for 2,718 applicants. Following his announcement today, how quickly can emergency care and A&E departments see changes, particularly to having more permanent staff, more consultancy places, but especially for seeing more training places in emergency care?
Secretary of State.
I'm grateful to the Honourable Member for her question. We'll be shortly setting out our urgent emergency care improvement plan so that we can deliver the year-on-year improvements that people deserve. The levels of waiting times in emergency departments, and not just in emergency departments, but ambulance response times, the entire system, are completely unacceptable. I refuse to use terms like temporary escalation spaces to describe the true grim reality of corridor care. I think this is a shameful situation, and I'm sorry, genuinely sorry, that patients are being treated in those conditions and that the staff are having to work in those conditions, suffering the moral injury as they do so. We have worked from the moment we came into government to make sure we got through this winter as well as we could, and I think that is reflected in the fact that despite the winter pressures, waiting lists have fallen 5 months in a row throughout the winter. But to the challenge that's being set out by the Royal College of Emergency Medicine about targets and standards, I would just say ahead of the winter, I was very clear with frontline leaders that patient safety must come ahead of performance targets, particularly the 4-hour targets. But when it comes to the 12-hour target, I believe that target is absolutely related to patient safety. I think the Royal College of Emergency Medicine would agree, and we've got to work together to get those waits of longer than 12 hours down as a priority, because those are the waits that are directly linked to safety and patient outcomes.
Could I gently ask Honourable and Right Honourable Members, and indeed the Secretary of State, if we have short questions and short answers, I will be able to get everyone in. Amanda Hack.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for his statement. I have two GP practices that have outlined that they've been waiting for Section 106 money to be released to improve their facilities, but it's been stuck between decision makers. Can the Secretary of State outline how these changes will help release these kinds of delays and finally allow residents in North West Leicestershire to get the facilities they deserve?
Secretary of State.
I'm grateful to my honourable friend for raising that example. She's welcome to contact my office to see if we can expedite that kind of decision making. In fact, people will have seen the work the Deputy Prime Minister is doing to speed up decision making in local government, which has an impact and bearing on the NHS. Indeed, we will work together on this to speed up so that where resources are available, we're getting them out and delivering change as quickly as possible.
James Wilde.
Thank you very much, Madam Deputy Speaker. My constituents are particularly concerned about the very bureaucratic approvals process for the new hospitals programme. Through investment committees, then NHS regional team, then the Department and NHS Capital Assurance, then the Joint Investment Committee, then the Treasury, and then finally to ministers. So can he guarantee that this decision, which I welcome, will speed up this process and that the business case for the multi-storey car park at the Queen Elizabeth and King's Lynn will be approved so work starts this year?
Secretary of State.
He makes an absolutely fair challenge about the bureaucratic nature of decision making. We're working with Treasury ministers and colleagues across government to take an axe to that unnecessary bureaucracy. He will be absolutely fuming when he finds out who is responsible for it.
Alison Gardner.
Thank you, Madam Deputy Speaker. Firstly, I am conscious of my former colleagues at NHS England who will be concerned about today's announcement. I am very confident the Secretary of State will do all he can to support them. But it is inescapable that the 2012 reorganisation did cause inefficient layers of management within the NHS, delivering poorer care and a greater cost to the taxpayer. So may I ask the Secretary of State how he plans to cut the excessive layers of bureaucracy and get resources to the front line and, crucially, to deliver better care for the people of this country?
Secretary of State.
Absolutely brilliant question. That's absolutely why we've put in place a transformation team led by Sir Jim Mackey that we will work with to start fundamentally changing the way that the NHS works, shifting more power, resources, responsibility out of Whitehall, closer to the front line, close to communities where those decisions are made, and getting rid of the unnecessary bureaucracy that drives patients and staff to distraction.
Adrian Ramsey.
Thank you, Madam Deputy Speaker, and can I thank the Secretary of State for his statement. We all want to see a well-run NHS that's delivering for patients, but as the Secretary of State knows, we currently have a situation where patients are being treated in corridors, staff are severely overstretched, and too many people can't get access to a GP and dentist when they need one. So it's in that context that I read with concern in the media in the last week plans for there to be £7 billion of cuts to services and for icbs to be asked to cut costs by 50%. So can the Secretary of State give us reassurance that as we go into the new financial year, we won't see cuts to frontline services? And when I meet with the Chief Executive of Norfolk and Waveney ICB next week, will I hear that there are cuts to frontline services being considered as a result of government budgets?
State.
I'm grateful for that question. I think the reports relate to the deficits that have been sent into NHS England ahead of the 25-26 financial year. These are completely unaffordable for the NHS and completely unrealistic. And those are the financial plans that are being revised as we speak, and why leaders have been gathered to London today to receive that message and set of instructions. I am asking frontline leaders to improve services, reform ways of working. They will have my support in doing that. As for the resources that are going in, I would gently point out that the investment the Chancellor unlocked in her budget for the NHS and social care dwarfs that was promised by the Green Party's manifesto.
Laura Kirk-Smith.
Deputy Speaker, I held a public consultation in my constituency on the future of the NHS, and the participants were crystal clear that we need to cut bureaucracy and get those resources to the front line. When they talk about the front line, they don't mean just hospitals, but also people out in the community, and crucially in my constituency in GP practices as well. Can the Secretary of State share more about how he intends to make that shift?
Secretary of State.
Absolutely. There are 889 million reasons for GPs to be cheerful, and that was the allocation for general practice before Christmas. That has resulted in very fruitful negotiations with GP leaders that will deliver the reforms that are needed, better access for patients, particularly online access to modern appointment booking. I mean, this is something that we've become accustomed to in every other aspect of our lives, and the NHS should be no different.
Jerome Mayhew.
Mr. Speaker, it's inescapable that one top-down reform is being fixed by another top-down reform that's going to last about 2 years, according to the statement. We have to recognise that whilst I wish it every success, that the experience of the NHS in Wales means that this reform on itself is no guarantee of success. The Secretary of State rightly said in his statement that change is hard. And it is, I'm afraid, inescapable, Madam Deputy Speaker, that whilst this reform is ongoing, the NHS leadership is going to be hugely distracted with turf wars, redundancies, and developing new working practices. So what steps is the Secretary of State going to take to prevent that distraction from having a negative effect on frontline services?
Secretary of State.
Madam Deputy Speaker, this government has come in with an ambitious reform agenda. And as we are embarking on that reform, we are cutting NHS waiting lists. We've done that 5 months in a row. We are reforming the GP contract. Those negotiations have successfully concluded. We are about to conclude with community pharmacy too. We have put in place a transformation team who are experienced frontline leaders with demonstrable track records, particularly in the case of Sir Jim Mackey, of delivering those changed outcomes. There will always be people who say it's too hard, it's too difficult, it's a distraction. That is how we've ended up with this status quo. That is how the party opposite presided over deliver the longest waiting list and the lowest patient satisfaction on record at the same time as spending staggering amounts of public money. So more money and no reform is not the answer. The lesson of the last Labour government is that investment plus reform delivers results. That's what this Labour government is doing.
Chris Vincent.
Thank you, Madam Deputy Speaker. Can I thank the Secretary of State for his statement today and pay tribute to the NHS professionals in Harlow and in particular the Princess Alexandra Hospital for the incredibly hard work that they do every single day. Does the Secretary of State agree with me that NHS staff work incredibly hard but are failed by an overly bureaucratic and fragmented system? And can I also ask him, does he think that part of the spiralling staff costs are due to the additional need of agency staff?
Secretary of State.
I'm grateful to my honourable friend for his question. We absolutely need to reduce the cost of agency staff in the NHS. It is costing the taxpayer billions. I genuinely think that money could be better spent on making sure we've got the right staff in the right place, on better terms and conditions and permanent contracts, and also where we do need that flexibility, driving that flexibility through the NHS Bank. We are determined to reform the way this works, to deliver better staffing, better outcomes for patients and better value for taxpayers.
Bob Blackman.
Thank you, Madam Deputy Speaker. And I welcome any measures to reduce the bureaucratic overload there is in the NHS. And I congratulate the Secretary of State in coming forward with his bold plan. And can I also say that we've got to take a sledgehammer to the business case process that frustrates the delivery of services and new buildings for the NHS. Could he have a look at the use of NHS land that is owned by the NHS that could be brought into use, for example, for new care facilities, for step-down hospitals, so we can free up hospital beds and get people into care and still get the care they need at a much lower cost?
Secretary of State.
I'm grateful to the honourable member for his question. He is absolutely right. The estate is vast. It is underutilised and we need to sweat our assets more effectively. We also need to reform bureaucratic processes. There are lots of reasons why you need to have in place tough controls on things like spending and procurement and value for money to make sure there is appropriate and effective use of public money. But businesses don't operate in this way. They're able to ensure and counter fraud and waste and poor value for money and do it much faster. That's what the NHS needs to do. And right across the public sector, we need to use our estate far more effectively to deliver better value for the public and better services for the public too.
Emma Foodie.
Madam Deputy Speaker, and may I thank the Health Secretary for the announcement that he has made this morning. As he rightly says, staff work incredibly hard, deserve our thanks, but we all recognise the huge strain that they and the organisation has been under. And the health service is consistently raised as one of the top concerns by residents in my constituency. So can the Health Secretary share how the announcement today, along with other measures that he has previously announced, will build an NHS that is there when people across Cramlington and Killingworth need it?
Secretary of State.
I'm grateful to my honourable friend for her question. We've got to deliver improved services for patients in every part of the country. And as she knows, her constituency and mine, which is on the London-Essex border, will have different needs, different contexts and different setups, and services may need to look and be shaped differently to meet those needs. But the standards should be consistent, the quality should be good, and the safety should be guaranteed at all times. That's a far cry from where we are. And I genuinely think that decisions about services for her constituents will be far better taken much closer to her constituents and to her community than decisions being taken here in Whitehall. And that's why, as we are delivering month by month, year by year, improvements in services for patients in every part of the country, we will also deliver the biggest devolution of power in the history of the National Health Service.
Tessa Munt.
Thank you, Madam Deputy Speaker. I really welcome Secretary of State's statement, and I'm particularly keen that he looks at the multiple layers of sign-off and the bureaucracy, sometimes forgets patients are at the other end of it. Moving to the frontline, hospitals in England have had to rely on charitable fundraising, as he knows, to buy some of the most cutting-edge radiotherapy machines. Because of NHS England's policies and bureaucracy. This year, highly advanced machines like CyberKnife, which have treated thousands of NHS cancer patients over the last 10 years, will need upgrading. But NHS England is refusing to include them in this year's funding because they were all bought by charities. I wonder if the Secretary of State would give, he was talking about giving people tools to do the job, could he change this policy so that our hospitals actually don't have to continue relying on charities for this latest technology?
I'm grateful to the honourable member for her question. This government has committed in our manifesto to doubling the number of diagnostic scanners, and we will deliver that over the course of this Parliament. I think that NHS charities have a valuable role to play. Philanthropy has a valuable role to play as an additional source of support to the NHS. When public funding is as tight as it is, I think we do need to look at how we can maximise the benefits and the impact from bringing together sources of public investment, private investment and voluntary sector philanthropic investment to deliver the most bang for the buck. You know, without knowing the details of a specific case, I wouldn't want to comment too strongly, except to say we are committed to doubling diagnostic scanners through public funds, but I'm not sure I would share necessarily the view that NHS charities don't have a role to play.
So, John Joseph.
Thank you, Madam Deputy Speaker. I know from my own experience of working in NHS frontline that how hard it has become over the years to get basic things done. Nurses, matrons spend hours and hours and hours to get basic changes done in their workplace in the front line. I therefore welcome the announcement from my right honourable friend, and will he ensure that by cutting bureaucracy we can bring more resources where direct patient care take place, which will help retention of nurses, healthcare assistants, and see more patients being treated quicker and getting the care they need.
My honourable friend is absolutely right, and actually some of the best innovation I've seen, the best improvements for patients has been led by frontline clinical teams that have had great executive leaders behind them, giving them the freedom and the tools to do the job. And I hope that as a result of these reforms, not only will we see the results for patients in the data, but staff and patients will feel the outcome and feel the difference in their experience of working in or being treated in the NHS.
Jim Shannon.
Madam Deputy Speaker, can I thank very much the Secretary of State for his statement today and for his positivity. First of all, for the waiting list down, for more staff employed and for the change that is needed. The Secretary of State in his contribution and to the Chamber today referred to the Scotland, Wales and Northern Ireland, and the Minister will know that we in Northern Ireland are having the very same problems that the Secretary of State is sorting out today for England. I know the Secretary of State are always very keen to see the positivity that comes out of here coming right across this nation. Can I ask the Secretary, will he have discussions with the relevant Minister, Mike Nesbitt, in relation to the Health Back Home to ensure that we can follow the directives that are happening here to make our health service in Northern Ireland every bit as good as what this one will be?
Secretary of State.
I'm grateful to the honourable gentleman for that question. In fact, I was recently in contact with Mike Nesbitt, offering some of that support and offering to work together to help improve the quality of health services in Northern Ireland, recognising that we have some advantages on scale here in England, and whilst recognising the devolution settlement, wanting to work closely, just as we are working closely with our friends in the Labour government in Wales to help them improve their services, and also learning from some of the things that the Welsh NHS does better than England.
Terry Jeremy.
Very much, Madam Deputy Speaker. I commend this statement, and can I thank the Secretary of State and his department for the excellent work that they are doing. And it's not a moment too soon in Norfolk, because we've got failing access to dentistry, difficult to get a GP appointment, and both the hospitals that serve my constituents have RAC. With that in mind, can I invite the Health Secretary to Norfolk to meet healthcare professionals to discuss the cumulative impact of so many challenges and discuss how these reforms can help improve patient care?
I'm grateful to my honourable friend for that question. That was a very kind way of reminding me that I'd already made such a commitment and have not followed through, so let me rectify that immediately.
Thank you, Madam Deputy Speaker. I'd like to start by thanking the Secretary of State for the boldness of his statement. It will take courage to bring around the change that my constituents desperately want, and it's great that Labour is showing that courage. As my constituents in North East Derbyshire know, particularly those in Killamarsh, we really struggle with access to GPs. Could the Secretary of State assure me that this will direct vital resources from bureaucracy to serving those in need on the front line?
Secretary of State.
I can give my honourable friend that assurance, absolutely. That's the objective of what we are doing, is to make better use of taxpayers' money so that we can deliver better care for patients, and that is not through bloated central bureaucracy, that is through more frontline capability and services.
Kevin McKenna.
Thank you, Madam Deputy Speaker, and I'd like to draw members' attention to my register of interest where of the more than 26 years that I worked in the NHS, 6.5 of them were in NHS England itself, in the brilliant strategy team there with brilliant people, which is why my heart goes out today to so many people who have insecurity about their jobs following this announcement, even though I believe it to be the right one. And this comes after years and years of chopping and changing at NHS England, NHS improvement, as political leadership has switched from one person to another. And honestly, one of the things that I am concerned about is making sure that clinical leadership is still heard at the centre. As a nurse, I found it harder to get into NHS England. Doctors and their career structures do find it more easy, and moving everything NHS England functions into the department, moving off of NHS terms and conditions, will make it harder for nurses, allied health professionals and other clinicians working in the NHS. So I'd like to hear from my honourable friend what he's going to do to ensure that that clinical voice comes right into the centre of Whitehall and along with the patient voice as well.
Secretary of State.
I'm extremely grateful to my honourable friend, and I absolutely echo what he said about the talents of people at NHS England, and I just say that I did not take this decision with the Prime Minister lightly. Indeed, it wasn't my instinct coming into government, but has certainly been shaped by what I've seen and experienced in the last 8 months. Clinical leadership is vital, and that's not just doctors, that's also about nurses and other clinical leadership. We've got a brilliant chief nurse who remains in place, and we're part of that clinical leadership team, and I can absolutely assure him that what we don't want is more or any kind of political interference in what should be decisions for clinicians. What we need is the right political leadership to give that clinical leadership the tools, the power, the freedoms to do the job that only they can do and they do best.
John Slinger.
Thank you very much. Thank you, Madam Deputy Speaker. This welcome reform can't come quickly enough in Warwickshire, where councillors, local health campaigners, I and others have been making the case for a doctor-led urgent treatment centre at our local hospital, the Hospital of St Cross, to complement the excellent nurse-led and GP out-of-hours service. But many of my constituents are concerned about having to travel to the larger hospital in Coventry and the long waiting times they find there. The ICB have a review of urgent care underway in Warwickshire, but I still don't know when it will be completed. And my constituents want to know when urgent care at our local hospital will be upgraded. So does my right honourable friend agree that his reforms to NHS England should equip ICBs more effectively to respond to local needs?
Secretary of State.
I'm grateful to my honourable friend for his perseverance. In bobbing for so long, they should prescribe it on the NHS. But I just say to my honourable friend, this is why I believe very strongly in local decision-making to make sure that services are configured and designed to meet the differing needs of local communities whilst providing the same standard and quality of care in every part of the country. What he also describes in terms of the frustration for people who will often and in the future necessarily live some distance from their general hospitals. It's why we've got to shift out of hospital with the NHS, not just the National Health Service, but a neighbourhood health service with as many services as possible closer to people's homes and indeed in people's homes. That's the exciting future that's up for grabs. That's the future we realise thanks to the reforms we're making today, and I'm delighted they've been greeted with such support from right across the House.
Can I thank the Secretary of State for his statement?